Hello, everyone. My name is Maya Rancic, and I'm going to be doing an infomercial on heroin today. And hence the title, There Is No Win in Heroin. Although that there might sound like there is in the actual name of the drug, I'm here to tell you all the reasons why there is no win in heroin. So what is heroin? Heroin is a narcotic, and narcotics are often viewed as some of the worst kinds of drugs because of how addictive and deadly they are. And some other known narcotics are morphine, codeine, and oxycodone, which you might have heard of. Narcotics are associated with the opium poppy, which is depicted down in the bottom right corner. And this flower is where the opium actually comes from. And this is what gives narcotics their potent and addictive qualities and what can classify them as narcotics. And many of these drugs, like heroin, are also referred to as opiates because of that association with opium. And so getting into the effects of heroin, heroin actually enters the brain rapidly and binds to opioid receptors that are usually involved in feelings of pleasure and pain, and also control your heart rate and breathing. So one of the many reasons people use heroin so much is because of how quickly the effects take place, especially when it's injected. And these effects I'm talking about is this kind of rush of euphoria, pleasure that the person will feel. And this is the main attraction to heroin in general. So getting into the long and short-term effects of heroin usage, that euphoric sensation that I was just talking about that comes from heroin may feel like you're winning at the time, but with that euphoria comes other long and short-term effects that can end up being deadly. So the short-term effects can be things like nausea and vomiting, dry mouth, severe itching, clouded mental focus, and going on the nod, which is like a back and forth state of being conscious and semi-conscious, which doesn't seem too bad, but then you get into long-term effects with things like collapsed veins, infection of the heart lining and valves, liver and kidney disease, mental disorders such as depression and antisocial personality disorder, and insomnia, which are a lot more severe and can have a lot more of an impacting effect physically and even mentally on the user. And then going into some overdose data here, anyone can overdose on heroin if it's taken in an excessive amount all at once. And as I mentioned earlier, heroin binds to receptors in the brain that are linked to breathing as well as your heart rate. So after taking an excessive amount of heroin and an overdose takes place, the user's breathing will often slow and eventually stop. And this can lead to hypoxia, which is when your brain isn't getting enough oxygen. And then that hypoxia can lead to a lot of different kinds of side effects, one of the worst being permanent brain damage. And then I have a little chart here that I found that kind of shows natural overdose deaths involving heroin. And so you can see that it kind of peaks here in 2017, kind of starts to drop off in 2018, and really starts to drop off towards 2021, which is really nice to see. And I'm hoping that this infomercial can continue that trend downward and help to achieve that downward slope that it seems to be taking from 2018 to 2021. So going into heroin addiction, heroin is a very, very addictive drug, not just because of its euphoric properties, but because of the dependency, the tolerance, and the withdrawal symptoms. So heroin users will most likely keep going back to the drug to get that pleasurable feeling that we were talking about, and that'll eventually become the only way that these users can feel any sense of euphoria at all. And then that leads to repeated use of heroin, and then that builds a tolerance and a dependence in the user to heroin. And then that dependence and tolerance can become so strong that if the user stops using heroin, the withdrawals that occur can become so debilitating that the user needs to seek out more heroin within mere hours of the last usage. So it gets very intense very, very quickly. And then going into those withdrawals, into the specifics of the withdrawals, the effects of heroin can last about 4 to 6 hours. And once that wears off, the user will start to formulate the symptoms of what we call dope sickness. And so heroin withdrawals essentially start out with the feeling of like a bad cold. So runny nose, tears, minor stomach cramps, things like that. And then that bad cold turns into vomiting, abdominal cramps, and goose pimples or goosebumps from chills and fever that are rapidly alternating. And that happens at about 12 to 48 hours after your last dose. And then 2 to 4 days later, the symptoms are probably the worst that they can be, because you're going to be experiencing everything that I just said, as well as powerful muscle spasms that can lead to these violent kicking motions and just really achy bones. And then these awful withdrawal symptoms contribute to heroin addiction, because who would want to go through all of that when you can just take more heroin and not have to worry about any of these withdrawal symptoms. And then going into a little bit about heroin addiction treatment. So the majority of heroin addicts actually cannot become completely clean because of how severe their addiction is and the withdrawal symptoms that come with the addiction. And not to mention that most heroin addicts cannot even get proper treatment when they want or need it. But when they are able to, most of the time they need to have a therapeutic compromise. So something that they need to take instead of heroin that can maybe wean them off of it a little bit slowly by slowly. But it is still probably a very strong type of opiate of some kind. And you're still going to be needing to get high just so that you can still stay in somewhat of a normal state of mind and sort of a normal state of your body. So heroin isn't just extremely addictive with awful withdrawal symptoms. Once you start, you could be dependent on this drug for the rest of your life, no matter how much treatment you get and no matter how much therapeutic compromise you have. You may never be sober again. And so this drug does its absolute best at trapping the user in every sense, even when seeking help through treatment. And honestly, guys, that doesn't really sound like winning to me. So thank you guys so much for watching. I hope that this contributes to you guys staying clean and sober, and especially not trying to go anywhere near any kind of opiates, especially heroin. And thank you guys so much for listening. And that'll be it for me.